This segment is sponsored by Hospice of the Chesapeake. Today we're talking about hospice care, what it is, when to consider it, and how it can bring comfort and dignity to patients and their families. And I'm fortunate to be joined by Dr. Rachel Jordan, Director of Advocacy and Interim Director of Hospice Operations at Hospice of the Chesapeake. First of all, welcome to the show.
Thank you. It's a pleasure to be here.
So let's talk about it. When should someone be considering hospice, and what does that process look like?
Certainly. So we want people to consider hospice early on, right? We want people to be able to enjoy the entire benefit. But really, when someone should consider hospice is when they have a condition, maybe life-limiting, chronic, and they're getting to a point where it's starting to affect their daily lives, their caregiving needs, and we're seeing a decline. They're having increased caregiving needs, but maybe their appetite's declining, they're losing weight, hospitalizations. We want them to consider it early and often.
Okay, so let's talk about what hospice really is about.
So hospice it's a philosophy, right? It's not a place. Sometimes people think it's a place. Most of our care is delivered in the home, but it involves an entire team, physicians, nurses, social workers, home health aides, chaplains, so that we can do a holistic view and care of a patient. So I can't prescribe for certain things, but my chaplain can help aid in those, right? And that's where that beautiful team comes into play. So again, hospice is this philosophy that we're caring for someone who is beginning the trajectory towards the end of their life, and we wrap that entire family in resources so they can focus on what matters most, being with their loved one, being where they want to be, and being cared for how they want to be cared for.
Very important, but I think sometimes people are afraid to reach out to hospice, or they wait too long, too late to reach out and get those connections and that help.
We see that often, and unfortunately, that is something that has been one of the biggest barriers that we're working to overcome. And it's so important that we're having these conversations early. Mom's been diagnosed with dementia. Now I'm going to talk with her doctor about when we should consider hospice, or what the next steps in her care are, or what I should look for that lets me know it's now time to request those services. So it's so important that people are not afraid and they understand how this looks and how it fits into their entire life.
And is there like a window of time we talked about before when this is maybe appropriate?
So to be eligible for hospice services, one must have an expected or life expectancy of 6 months or less. And that's really determined by their provider, whether it's a nurse practitioner, physician's assistant, or a physician, where they look at the patient holistically and they say they have a condition that if it continues to progress, I believe they have a life expectancy of 6 months or less. That's not to say we'll reach 6 months and you're off of hospice, right? We don't have a golden globe. We can't determine exactly. We go by our best medical judgment.
Gotcha. And let's talk about the concern some people may have. If I go into hospice, do I have to give up my physicians that I'm accustomed to?
Absolutely not, because some physicians have been in their patients' lives longer than I've been alive, right? And that relationship is so important. So what happens is when someone enrolls in hospice, we become in addition to their provider. So we're communicating with their provider, letting them know how things are going, how things are coming along, letting them know what their needs are. So absolutely not, your provider can still be as involved as they'd like to be, and we actually encourage that.
Let me ask you, you have worked in hospice now for more than 10 years. What keeps you there? Because this is an important service, but it's also a sad time in someone's life.
You know, coming into this world and leaving this world, these are life events, and we're all going to go through that. I can tell you, I don't know if you'll hit the lottery. I don't know if you'll get married. I don't know if you'll have children, but you'll come and you'll leave. I've been in hospice for so long because this is where I find my passion. The people I work with, it's so rewarding getting to be able to help people understand this life event, holding their hands. You see them out and about and they're like, thank you so much. And it's that passion that drives me to come to work every day.
Wow. Well, I think it's important, and I think it's something that we should all do some research on ahead of time, as you know, so you don't wait to the last minute. We're going to put all that information on the screen so you can reach out. Dr. Jordan, you've been so insightful here today, and I appreciate you giving us some of your time.
Thank you so much.